Ever wondered what cancer is and how it affects our body? Cancer is a disease that occurs when certain cells in our body start to grow uncontrollably, forming tumors or spreading to other parts of the body. It's a bit like a garden where weeds suddenly start to grow and take over. These weeds, or abnormal cells, can disrupt the normal functioning of our body and lead to serious health complications. Understanding cancer is crucial not just for medical students but for everyone. It's like knowing your enemy. The better we understand it, the better equipped we are to fight it. And when it comes to fighting cancer, there's an array of treatments available, each with its own unique approach, from surgery and chemotherapy to radiation therapy, targeted therapy, and immunotherapy. Now let's dive into the different types of treatments available for cancer. First up, we have surgery, a common treatment option for cancer. Surgery involves the physical removal of cancerous tissues or tumors from the body. It's a direct approach targeting localized tumors before they get a chance to spread to other parts of the body. This is vital in limiting the cancer's reach and preserving the patient's health. However, it's important to remember that each case is unique and requires a tailored approach. Surgery can be a powerful tool in the fight against cancer, but it's not the only weapon in our arsenal. Next, we delve into the world of chemotherapy. This treatment method employs powerful drugs designed to kill or halt the growth of cancer cells. Imagine a battleground where these drugs act as soldiers, their mission to eradicate the enemy, the cancer cells. These drugs work by targeting cells that multiply quickly, a characteristic of cancer cells. However, other cells in our body, such as those in the bone marrow, hair follicles, and the lining of the mouth and the gut, also multiply rapidly. This explains why chemotherapy can sometimes cause side effects like hair loss and mouth sores. Chemotherapy can be administered in various ways, most commonly orally or intravenously. It's often part of a broader treatment plan used in conjunction with other therapies to enhance effectiveness. The choice of chemotherapy drugs and the schedule of administration can vary greatly, tailored to the individual's cancer type and stage. Chemotherapy, while potent, is just one part of a multifaceted approach to cancer treatment. Now, let's shed some light on radiation therapy. This approach uses high-energy rays, much like rays of sunlight, but far more intense and focused, to precisely target and destroy cancer cells. Imagine each ray as a tiny, invisible superhero, zapping away at villainous cancer cells while leaving healthy cells largely unharmed. Radiation therapy can be delivered in two ways, externally or internally. External radiation, or external beam radiation, is akin to getting an X-ray, but it lasts a bit longer. Internal radiation therapy, also known as brachytherapy, involves inserting a small radioactive source directly into or near the cancer site. This allows us to deliver a higher dose of radiation to the cancer while reducing exposure to healthy tissues. The type and location of the cancer determine how radiation is delivered. For instance, a tumor in the brain would likely be treated with external radiation, while prostate cancer might benefit from internal radiation. Radiation therapy is a key player in cancer treatment, but it doesn't work alone. Lastly, we explore targeted therapy and immunotherapy, the cutting edge of cancer treatment. Targeted therapy is a precision approach aiming to block the growth and spread of cancer cells while sparing healthy cells. It zeroes in on specific molecules or pathways involved in the growth and spread of cancer cells. By blocking these, we can stifle the cancer's progress without causing undue harm to normal cells. Next, we turn to immunotherapy, a treatment that capitalizes on our body's natural defense mechanism, the immune system. It works by enhancing or modifying our immune response to recognize and annihilate cancer cells more effectively. Think of it as equipping an army with better weapons and strategies to conquer an enemy. Different types of immunotherapy, such as monoclonal antibodies, checkpoint inhibitors, cancer vaccines, cytokines, and CAR T-cell therapy, all aim to enhance the immune response against cancer cells. They help our body's natural defenses to fight the disease more effectively, offering a ray of hope in treating various types of cancer and improving patient outcomes. With these advanced treatments, we're taking the fight to cancer like never before. By understanding how these therapies work, we can all be better informed and prepared in the battle against this disease.